This week we're going to be doing chapter 2 in our book. It's the basic concepts of pharmacology. The learning objectives for this chapter is to understand receptors and their function and mechanisms of drug actions, appreciate the general principles of pharmacokinetics and the importance of those principles in developing and testing drugs. We're also going to understand that drug effects have beneficial and harmful effects. And then you need to be familiar with the common terms used to describe drug interactions. Okay, drug actions. You should have a basic understanding of the processes that drugs go through to act on the body. Drugs work by a variety of chemical mechanisms. The body continually fights to maintain a state of homeostasis. You should know what this means. It's the stability of an organism, and it's achieved by a system of control and feedback mechanisms. This causes the body to keep its living processes in balance. Drugs are used to restore and maintain homeostasis. Okay. Cells must be able to communicate so the body can maintain control over their processes, and they do this by using messengers and receptors. They communicate through the messengers, and the receptors kind of tell the messenger where to bind. There has to be a certain receptor there to bind with a certain messenger. They have to be the same. They have to be able to communicate. Cells communicate through the action of chemical messengers, which they produce and send into extracellular fluids. Some of the chemical messengers are histamine, prostaglandin, and bradykinin. Messengers recognize and communicate with target cells via receptors. The receptors are located on the surfaces of the cell. Like I said, they attract the messenger. Okay, when the messenger binds to the receptor, there is an effect produced in the body. And it just depends on what they're trying to do. Different messengers binding to the receptors, they do different things. Like different drugs do different things in the body. Different cells have different receptors so that a messenger can bind to a specific cell type. Their chemical structure must be complementary to the receptor. The receptor site may have specificity. Affinity is the strength by which a particular chemical messenger binds to the receptor site or the cell. Okay, this is the mechanisms of drug action. Drugs act like chemical messengers to perform their specific actions in the body. By binding to receptors on or within body cells, the drugs can either mimic or block the action of a chemical messenger, or they can exert powerful and specific actions in the body. So drugs are developed differently. They develop them to mimic something that naturally occurs in your body, or they can stop something that naturally happens in the body, or something like that. With the drug actions, you either have an agonist or an antagonist. The agonist drugs bind to a particular receptor and trigger the same cellular response as the body's own chemical messenger. So it enhances a natural response that your body normally has. The antagonist drugs compete to block the action of the endogenous messenger. So it binds to that receptor site to prevent the messenger that's natural in the body from binding to that spot. So it's blocking something from happening. Some drugs produce their effects by embedding themselves in the cell membranes. Lipids are fatty molecules, and they make up the cell membrane walls so that they repel water. Solubility is the ability of a substance to dissolve in a fluid, and the effectiveness of these drugs is related to their lipid solubility. Some drugs combine with specific molecules in the body, like enzymes, proteins, and nucleic acids. Antidepressants work that way. They bind to the protein that removes the messenger serotonin. Some drugs act without direct interaction in the cell. Mannitol is one of those. It interferes osmotically with water reabsorption by the kidneys. It just works through that osmotic effect. It can change the amount of water available to flow across the permeable layer. Pharmacokinetics is the study of the activity of a drug within the body over a period of time. It includes absorption, distribution, metabolism, and excretion of a drug. You guys should know these terms very well. It's going to help you through the whole course. You should be able to tell me where absorption takes place, where distribution takes place, where metabolism takes place, and excretion. Be really familiar with these terms and these paragraphs in the chapter that talk about these things, and in the kidneys and all of those cycles. Pharmacokinetics also includes the metabolites of a drug in relation to the time they're in the body. This is just a little picture of the pharmacokinetic process. This will help you to know, like I said, where those processes are taking place. This picture is also in your book on page 28. Just be really familiar with this. Okay, now we're going to start with absorption. Absorption is the process whereby a drug enters the circulatory system. This just talks about the different routes of medications you can take. You can do oral routes, IV routes, transdermal, under the tongue, injections, so many different ways you can take a drug, but most of the absorption of a drug takes place in the small intestines, and this is because it has a large surface area. All of your food that you eat is absorbed in your intestines too, well, most of it, and that's because of the large surface area as well. You should remember that absorption is slower if you've taken an oral route of medication, but it is a lot faster if you take an IV route, and that's because it's entered directly into the circulatory system. With an oral route, you have to take it, it has to go through your GI tract where it's absorbed through your small intestines and then sent into your circulatory system. Distribution is the process of the drug moving from the blood into the other body fluids and tissues and to its sites of action. Blood flow is the rate limiting factor. It's the big one. If your blood's pumping faster, the drug will get distributed faster. There are 3 other factors that affect the rate of absorption, and that is in your book on pages 28 and 29. So read over those 2. Okay, metabolism is the process by which drugs are chemically converted to compounds and excreted through the metabolic pathways. The metabolic pathway is the sequence of chemical steps that convert a drug to a metabolite. So then the metabolite is the substance into which a drug is converted by metabolism. So make sure you know those 3, just don't get them confused. Induction are drugs that increase your metabolism. Inhibition decreases your metabolism. So on page 29, go over those and look at some of the examples of the drugs that cause induction and the ones that cause inhibition. Also look over the competitive inhibition and the non-competitive inhibition. Elimination is the removal of the drug or metabolites from the body. This occurs primarily through the kidneys, through urine, and the liver through feces. There's other routes that exist, but those are the 2 main ones. The clearance is the rate at which a drug is eliminated from a specific volume of blood unit per time. You'll see a lot of tests done if you're in the hospital or when you do your rotation in a hospital, where they do a creatinine clearance and things like that with vancomycin. They're trying to see if the drug is being eliminated from the body properly with vancomycin. This is just a discussion about where the primary sites of elimination are in the body. Like I said, it's the kidneys and the liver. It can also be exhaled through the lungs or excreted in perspiration. Pharmacokinetic parameters. The pharmacokinetic processes determine how a drug should be administered to obtain a specific response. They treat disease states and not produce toxicity. Dose is the quantity of a drug administered at one time. There are a lot of different doses that people are given. Your body gets used to a certain dose. Sometimes they have to up your dose, but then there comes a ceiling effect, and that's the point where no clinical response occurs, even if you move the drug higher. This is a dose response curve, and it's on page 30. And it just shows your maximum therapeutic level with your dose, and where the ceiling effect is, it levels off. So it doesn't matter if a drug has a ceiling effect at 10 milligrams. If you gave them 20 milligrams, it wouldn't do anything else. It wouldn't help the body anymore. Determining how the body handles a drug. They test fluids over time, and that demonstrates how the body handles it. They'll do I'll use vancomycin again because it's so often used in the hospitals, especially. So they do levels throughout the day, and the pharmacists check that every day. So they'll do a vanc trough, and that's the lowest level of drug in the blood. So they'll do it usually after 24 hours. And if the vanc trough is too high, sometimes they will hold a dose or lower the dose. If they do a peak, the peak is the highest level of the drug in the blood. Okay, only a portion of a dose that's given becomes biologically active in the body, and that portion is called the bioavailability. With the first pass effect, that's the metabolism in the liver before a drug reaches systemic circulation. When you give an oral drug and it has to go through the intestinal wall, the liver, and the blood, all of those steps, its first pass effect is really small. It's slow. Some drugs have a really high first pass effect, and they have to be administered by injection. So this just means that the drug with a really high first pass effect means that it might get absorbed too much before it reaches the systemic circulation, so it has to be given right into the injection, right into the IV, or other things like that. Drugs with small, slow first pass effects can be given orally, and they will be fine. The therapeutic range is the optimum dosage that provides the best chance of successful drug therapy. When the amount of drug gives the desired response, the drug is at its therapeutic level. So that's like we saw with that chart earlier. That maximum therapeutic level is also the ceiling effect. This is just another little chart that's on page 31 of the therapeutic range. That blue area right in here is the therapeutic effects. Given drugs in that dose range will give either weak to strong effects depending on the dosage. Given a dose under that will be underdosing. It won't give enough effect in the body. Given over here is excess dosing. That can be an overdose, toxicity, death, things like that they may have to have a code for. You might have to have reversing meds on hand for things that way. So that's your therapeutic level. You'll also have like a maintenance dose. So then when you reach your therapeutic level, you will be on a dose that will just maintain your therapy. The duration of action is the length of time a drug gives the desired response or is at a therapeutic level. This is just a little chart showing the duration of action. It's also on page 31. So this is just saying that the concentration after the drug is given at hour 0, And then by the time you get up here, it's saying at hour 3, the drug is starting to bind. It took action on the body. So then up here, it's really, really working in the body. And then by hour 7, it's being metabolized and excreted from the body. So it's just making its way out. So then by down here, by 9, the drug level's all almost back to 0. This slide is basically just telling you the definition of pharmacokinetic modeling, which is the method of describing the absorption, distribution, metabolism, and elimination of a drug within the body mathematically. It's basically talking about the 0 order process, the 1st order, and the half-life. So make sure you look over those and know those definitions and what half-life is, just meaning like what is the hour where half of the drug is gone from the body? How long is it before half of the drug is gone? This slide just talks about the different effects that drugs have in the body. You have the beneficial responses, and then you have like side effects, allergic responses, things like that. The therapeutic effect is the action for which the drug is prescribed. Why is this drug prescribed? What are they using this drug to heal, to make better, to keep on track, like your cholesterol, your diabetes, things like that, therapy for something. The local effect is confined to a specific part of the body. That's like using lidocaine. Lidocaine patches, lidocaine injection when you're getting stitches, things like that. A systemic effect is generalized, all-inclusive effect on the entire body. This is like blood pressure medicines, cholesterol medicines, antidepressants, things like that. What kind of effect does it have on your entire body? What are some of the issues a healthcare practitioner considers when selecting a drug for an individual patient? This is actually kind of good for us to talk about, especially with either younger people or older people. They have some drugs that have to be taken twice a day, like a twice a day blood pressure medicine or a twice a day cholesterol medicine, or they have one for once a day. A lot of people have trouble with compliance when they're having to take a drug more than once a day. So a lot of places are looking at developing drugs that are just once a day. That helps with the compliance. A lot of the other issues are just like what other medications are they on, what allergies are they on, things like that. They could have something that drug is contraindicated for. They could have an allergy to a certain drug. So make sure you read up on that, the indications and the contraindications of a drug as well. This is their considerations when selecting a drug. The indications, that's the diseases, the symptoms, the conditions which the drug is known to be a benefit. So like with lisinopril, the indication for that drug is a blood pressure medication. You got glyburide, that would be for like blood sugar monitoring for diabetics. Anything. Indication for any kind of drug. You have them for seizures, you have them birth control, diabetes, cholesterol, blood pressure, anything. To treat an infection, that would be the indication. An antibiotic. The contraindications are the diseases, symptoms, and conditions for which the drug will not be beneficial and may even do harm. The drug shouldn't be prescribed if the patient has that condition. So they may have one condition that they could use a specific drug for, but they may have another condition where if they take that drug, then it could possibly kill them. Side effects are the secondary responses to a drug other than the primary therapeutic effect for which the drug was intended. You can have allergic responses, a rash, anything like that, but then, You can have like anaphylactic responses that cuts off your airway, cause you to go to cardiac arrest, things like that. If anybody has any kind of drug allergy, you should always alert the pharmacist. Always make sure it's in there. Always, always, always ask your patients or customers or whoever what kind of side effect they have. If they say, oh, I can't take that, it causes an allergic reaction. Make sure you know what allergic reaction, because sometimes if it just causes itching, but they really, really could use that drug, then they can still take that. But if they say that it's anaphylaxis, never give them that drug. Always alert the pharmacist. They will not want to take a chance on that. Some other side effects can be drug dependence, addiction, abuse, and tolerance. A lot of those are with the narcotics and things like that. That's the addiction and abuse. The dependence is meaning that they have adapted to that drug and they've become dependent on that drug. Without that drug, they can't function as well, but it's not really an addiction. They're really different. So make sure you read on page 33 about the difference between dependence and addiction. There is a difference. Also, the tolerance is when they build up a tolerance to a drug, like with morphine and OxyContin, they might start out at a 10, 15 milligram dose, but their body gets so tolerant to that drug that they need higher doses. And I have seen people up to 90 milligrams of morphine 3 and 4 times a day because their body has gotten so used to that drug. And it's really sad sometimes, but if somebody's in constant pain or like an old person, sometimes that's what they have to do. This is drug interactions. One drug can have an effect on the action of the other. Foods and other substances can have interactions with drugs. A common way a substance can interact is by inducing or inhibiting enzymes that metabolize the drug. Like your book says, a grapefruit can provide an example of a food-drug interaction. Grapefruit juice contains certain chemicals that inhibit a form of cytochrome P450 that is found primarily in the intestines. Because of that, less of the drug undergoes first-pass metabolism. So more of the drug is absorbed into the bloodstream, risking an overdose. So, like I said, when the first-pass effect is increased by another drug, then too much of the drug can be absorbed at one time and the patient can be overdosed. That's like another thing, especially with fentanyl patches. You'll see a lot of crazy stuff when you get your experience built up. But the patches, they have systems in them where it releases so much drug over 24 hours, but you only change that patch every 3 days, so it has enough drug for 3 days. You'll see a lot of people want to hurry up and get it fixed, and they'll cut the patch open and sometimes suck on it, drink the stuff out of it, and it will kill them because it gives them 3 days worth of drug really, really fast, and a lot of people have died from that. Another important thing is if you're doing MedRec or anything like that, make sure you get the list of all the drugs. Even if you don't think the vitamins and the herbal supplements are that important, they really are, because a lot of the herbal substances interact with medications. They have a lot of herbal stuff like red rice yeast that helps with cholesterol. Well, then if they give them a high dose of a cholesterol medicine, then it could bring it down too low. Just different things like that. Common drug relationships. This is on page 34 of your book. Addition is the combined effect of 2 drugs is equal to the sum of the effects of each drug taken alone. So, antagonism is the action of one drug negates the action of a second drug. Potentiation and synergism. Potentiation is one drug increases or prolongs the action of another drug, and the total effect is greater than the sum of the effects of each drug used alone. A second drug can be prescribed to increase the first drug's potency. This term is used when one of the drugs has little or no action when given alone, and the second drug increases increases the potency of the first drug. So, this is whenever you'll see combo drugs together. Sometimes drugs need that help of a second drug. And you'll see that as we go through the other chapters of different drugs that can be taken alone, but with the help of the second drug, it can speed up the absorption or things like that. Synergism is the combined effect of two drugs, is more intense and longer in duration than the sum of their individual effects. Drugs that work synergistically are usually prescribed together. So that can help. Prescribers and pharmacists need a complete list of all prescription drugs, OTC medications, and herbal remedies a patient is taking. Like I said, you'll go in there and do MedRec and you'll say, I need to know all your medications. 9 times out of 10, they're not going to have any vitamins or any herbal supplements on their list. But always ask, and they'll be like, they don't want to tell you because they don't want to take it in the hospital. They don't want to be charged for it. And you can say, well, that's fine if you don't want to take it here, but I still need to know because some of those vitamins and herbal supplements can interact with your drugs that you're taking on a routine basis. The pharmacy technician should routinely ask for this information. So if you're in retail, always ask if there's any new drugs that you've been taking. The pharmacist needs to know that so that they will know if there's an interaction. It says name a common food-drug interaction. We just went over that with the grapefruit. Assignments. You don't really need to pay attention to this. You have all of your assignments on Canvas. So you'll just do the chapter review at the end of this book. All the multiple choice and true false, the pharmacology at work. I'm going to look over this internet research and reflecting on the profession, but your instructions will be in Canvas, so just do that. Your study notes and your initial discussion post will be due by this coming Sunday, which is the 25th, I believe. And then the next week, the next Sunday, your chapter review, your workbook exercises, your additional 2 responses are due those days, and your quiz. So you have 2 weeks. Everything is due by February 1st, except for the study notes and your initial discussion posting that's due the 25th. So don't forget that. All right, thank you.